Hello and welcome to our Positive Health webinar series. Thank you so much for joining today, where we have Dr. Z. Colette Edwards, the visionary founder of Positive Health, here to share some important information on how to help you navigate your healthcare journey. Knowing what you need to know about healthcare can be tough enough and confusing, but when you factor in going through your menopause journey, it can be somewhat overwhelming for many women. My name is Kim Pancher, and I will be your host today. We here at Positive Health are trying to bring in some experts, and we're so honored to have them here to share some really great information on menopause topics that are important to you. So now I'd like to get us kicked off, and I'm very happy to introduce Dr. Edwards as our presenter on this topic of navigating healthcare journey. She has an extensive tenure in the medical field and the healthcare industry, plus her vision as founder of Positive Health for women going through the menopause journey. And she is so committed to helping people make that change for the better. And we are so very honored to have her with us today. Thank you so much, Dr. Edwards, for joining us here. And I think we would all like to hear more about your career and how you got to where you are today, if you wouldn't mind sharing that with us.
Okay, thank you, Kim. And thank you for being the lead for coordinating everything and making the webinars and the podcast series happen, as well as the newsletter. So, I am a gastroenterologist who also has training in health and wellness coaching, as well as translational health disparities from the NIH. And the pathway to my interest in menopause was related to a friend who had a horrific experience with her PCP and GYN. She actually recognized that her symptoms were related to the menopause journey, which many people do not. And she was being encouraged strongly, I'll put it that way, by her PCP and her GYN to be on hormone therapy. And this was at a time where the recommendation was that no one be on hormone therapy because of a study that had come out of the Women's Health Initiative that actually was misinterpreted and has set things back as it relates to menopause. Menopausal hormone therapy significantly. And she had figured out things to do and actions to take that actually she was satisfied with and which managed her symptoms. Her physicians continued to press her to be on hormone therapy, and it got to the point that her GYN actually got very angry with her because she would not go along with his program. And that was the end of that relationship, as you might imagine. She came and told me, my mouth dropped open, and it takes a lot for my mouth to drop open. And then I got very angry. And then I started saying to myself, well, what is out there and what experience are women having when they're going through this normal, natural stage of life? And what I found was not very much. I did additional research from a market perspective, and lots of people were saying that their experience were less than satisfying, that they were often blown off, or that there was insufficient knowledge on the part of the people from whom they were seeking care, and they really didn't know where to go to learn more themselves. And at that time, there wasn't a lot out there. Fast forward, did more research, and sad to say, little had changed in terms of what women were saying in terms of being completely unprepared and feeling like things came out of left field and not often having satisfying interactions in the healthcare system. And there are very good reasons for that from the standpoint of medical and residency training being grossly insufficient, with 70% basically of training programs not having to meet designated curriculum. So that's how I got on the pathway to positive health. As it relates to navigation of the healthcare system, along with my co-author, her more from the perspective of a patient, me from the perspective of both a physician and a caregiver, wanted to provide information, tips to help people better navigate what is a very complex, complicated system with lots and lots of challenges that gets more complicated and complex as time goes on, as there's more and more technology involved. And the relationship between patient and clinician, I think, has become more challenging to establish and maintain. And so that was really the impetus for the book, which we wrote during the course of the pandemic. And so today I want to share some of the information from the book, and I will be providing information as it relates specifically in some instances to the menopause journey as an example. So that is my story that I'm sticking with, and we can move forward. I'm going to go off video during the presentation. And so the agenda for today, as you can see as topics, is around prevention, benefits, care coordination, your emotional health, health disparities, and something that most people really don't want to think anything about, which is the end of life. And then we will have certainly enough time for questions. So going on to the next slide, you can see this is just, this is a picture of my co-author, Charlene Rothkopf, whose journey started off with a seizure at home that turned out to be thankfully a benign brain tumor, but was followed by 6 years worth of complications. And then on the next slide, I'm sure that people are aware of the impact that lifestyle factors can have on your health. In this country, the leading causes of death and disability are primarily conditions that are related to lifestyle. And so I always believe in instances related to your health and many other things in life that people have a lot more power than they recognize. But this is definitely one of those scenarios where you do have more control than in a lot of other areas of your life. That's not to say that that makes it easy, but it makes it easier because you actually do have some control in the situation. So one of those areas is smoking, and the rate of smoking has plummeted significantly in this country, but it's still hanging out at 15 to 17%. And as it relates to menopause, it is a risk factor for going through menopause at an earlier age. And the significance there is that if you go into menopause at an earlier age, and the typical age for menopause in the US at least is age 51, although that varies depending upon race and ethnicity, with some people having it earlier. Typically women of color are earlier than white women. But if you go in earlier, that is a longer period of time that you don't have estrogen around. And the drop in estrogen that happens as a result of menopause increases the risk of a host of chronic conditions like hypertension, heart disease, stroke, metabolic syndrome, high cholesterol, anxiety, depression. And so the besides the risk that people know about as it relates to lung cancer and oral cancer, throat cancer, esophageal cancer, then you can also add one more reason for not smoking, which is earlier onset of menopause potentially. As it relates to eating habits, and given the increased risk that I just mentioned for a lot of very common chronic conditions in this country, besides reducing the risk from that perspective, the eating habits that you have can have an impact as it relates to your symptoms, particularly as it relates to hot flashes. So there are certain foods that can trigger a hot flash in some people. And also as it relates to the weight gain, which is a common complaint during the menopause journey, where people tend to gain weight. The weight tends to be distributed around the waist, which in turn, if it's internal fat around the organ, sets up an inflammatory process, which then increases the likelihood of chronic conditions like heart disease. So eating habits as it relates to chronic condition risk as well as weight gain during the menopause journey, it's not at all uncommon for women to have cravings, and typically they aren't craving celery, I can tell you that. The menopausal changes can also have an impact on your gut microbiome and then throw off the hormonal balance of the hormones that are responsible for your appetite. With regard to physical activity, the impact of physical activity, I think, as more time goes on, it seems like the benefit increases as we learn more and more. And for the menopause journey, physical activity would have a role to play as it relates to osteoprevention. That's one of the conditions where the drop in hormone levels increases the risk of osteoporosis. Physical activity for some people can reduce symptom severity. Physical activity helps in terms of weight gain, maintaining a healthy weight. And during the menopausal journey, the type of physical activity you engage in terms of the balance, the mix, the strength training becomes much more important from the standpoint of maintaining muscle mass and bone density, and maintaining that muscle mass also will positively impact your metabolism. With regard to alcohol, there are now organizations like the World Health Organization that maintain that there is no safe level of alcohol consumption. I would say that that is not universally held in the medical community, but as it relates to the menopause journey, alcohol can definitely trigger hot flashes and night sweats in some people, definitely disrupt sleep, and the calories that go along with it can contribute to weight gain. Additionally, it may be that you, because of the sleep disruption, the next day you're going to be fatigued, which is also a very common complaint. And the fatigue is and lack of sleep is definitely not going to help if you're having brain fog symptoms. The period of time during the perimenopause, which is the time leading up to menopause, is a very stressful time for lots of people, completely unrelated to the menopause journey. And then you just add that on top of it. It is a period of time that for a lot of women, they are at a big point in their careers in terms of career advancement, in terms of more opportunities being made available, promotions, etc. It's also a time when it's not uncommon for women to find if they have children, children on the one side in terms of caregiving, and parents who are getting older on the other side, and that's on top of everything else that they have to manage day to day. And the study has shown, as it relates to caregiving, that as the number of hours spent in caregiving increases, the severity and frequency of symptoms can be negatively impacted. As it relates to relationships, it's not uncommon for women to have emotional and mental health changes, which I'll talk about in more detail later. We've already talked about the role that stress can play. And if you turn that around and you have relationships that are very supportive, if you have shared with people what you're going through so they understand, then that in and of itself can make your experience as you're going through the symptomatic period of the journey, or the more symptomatic period, I should say, a much better one for you. Next slide, please. So it's very important to find clinicians that you can see on a regular basis. And I emphasize the combination of OBGYN and primary care. Lots of women consider an OBGYN their primary care physician, and it may be that for those who have insurance, they're even considered a PCP within your insurance coverage. Some companies do, some companies don't. But OBGYNs are specialists in specific things about women's health. They are not trained to be managing the typical types of things that are very common in this country and that become more common as you get older, like hypertension, heart disease, diabetes, etc. That's not to say that they don't have knowledge, but in terms of the type of management that you need and a big picture view of everything that's going on with your health, that is not the role or the reason that they went into the specialty that they did. I recognize that it can be difficult to find an OBGYN and a primary care practitioner that's a good fit. It's unfortunate, it's the reality, and sometimes you don't have the luxury of being able to search for someone else because there's no one else available. There are lots of people who are not taking on new patients, but I would say that if you are in a position where the relationship is not meeting your needs and you do have the opportunity to look for another practitioner, that is at least worth a try to optimize your health and well-being. As it relates to management of menopausal symptoms, I've mentioned that 69% of the residency programs don't have a designated menopause curriculum. There are definitely OBGYNs out there who have taken the time and put in the energy to learn more and become expert at management, but there are a lot that have not. Surveys have shown that about 35% of clinicians surveyed have admitted that they aren't up to date, for example, on the latest and greatest as it relates to hormone therapy. There are certification programs. One is through the Menopause Society, and they have a database where you can do a search to see if there's someone in your area. And so if you find yourself with someone who's not meeting your needs, you may want to give that a try. There are also other companies out there now that are focused on virtual care consultations and management of the menopause journey. So more more resources are coming online, but just to give you one example, the number of clinicians who've been trained through the Menopause Society certification program is about 2,000. There are 27 million currently women who are in the menopause journey, and every year it's 2 million more. So you can see the big disparity between the supply versus the demand. Next slide, please. So checkup, screenings, immunization. And for these slides, prevention is the best medicine. Obviously, if you cannot get a problem in the first place, then that's the way that you want to go. If for whatever reason you do find yourself with a problem, the earlier that you find it, the better your chances of getting a resolution that is optimal. I can't stress enough the importance of checkups, screenings, immunizations. We see that there are increasing rates of breast cancer at a younger age in women, increasing rates of colorectal cancer at a younger age, meaning younger than 50 for both men and women. As a result, the recommendation for colon cancer screening has shifted from 50 to 45. If you are African American, you should probably be having a conversation about potentially getting screening starting at 40, just because of the greater prevalence and risk of colon cancer in the African American community. Some of the reason that is thought for these increased risks of cancer are related to obesity. Each year, the percentage of the population in this country that is obese increases, and that has a whole cascading effect for lots of conditions: cancer, diabetes, hypertension, heart disease, etc. There have also been increasing rates of uterine cancer, not exactly clear why, and especially in the case of African American women. And then you have scenarios with regard to the flu and the HPV vaccine for cervical cancer prevention. The studies have shown that for the population that has gotten HPV vaccine, significant reduction in the prevalence of cervical cancer. I know lots of people this year who have gotten the flu, and it has not been a pleasant experience. It's been particularly severe this year. Getting the flu will not give you a guarantee that you won't get the flu, but at least gives you a fighting chance. And although for most people it is the case that it may be a horrible experience that takes a while to recover from, and you may have lingering cough for weeks, it is not as benign as people may think. One of my most unforgettable experiences going through medical school and residency was a patient who got the flu, ended up with pneumonia, and was in the ICU for 3 months. And so I learned early on that the flu is something to be taken seriously. I bring up the increased cancer risk as it relates to breast cancer and uterine cancer because it's something that also needs to be taken into account if you are being considered for hormone therapy. That may come into play and may mean that may not be an option for you, depending upon the symptoms for which you are being treated and the form of hormone therapy that would be needed. Next slide, please. I can't emphasize enough the importance of communicating with your practitioner and making known as well you can where you're coming from, what your perspective is, and why about your health and well-being, and being realistic with the person about what you can and cannot do given your lifestyle, your financial situation, how many different people you're a caregiver for. But it's important to go in prepared, because that will make the most of the time that you have and make things more directed, focused, and efficient. So have your questions and concerns on a list that you bring with you, because it's not uncommon when a person goes to see the doctor, there's an element of underlying fear, anxiety, concern, even if things seem to be going okay. And the end result can be that all those questions that you were going to ask, you suddenly now have forgotten. It's important to have your healthcare practitioner know about all your medications, including things that are over the counter, including supplements, including herbal medicine. It's become more and more clear to me the importance of that information and the importance of getting really clear instructions about medications and what the potential interactions are, as well as the timing of when you may take a medication versus another medication, or in relationship to a supplement or something over the counter, and whether or not it needs to be with food or without food, or certain medications, for example, that you should not be drinking grapefruit juice with. Take notes, because you will be happy to have them later, to remind yourself of what actually happened and bring some clarity to where you landed and what your next steps are. And it's important to gather as much information as you can about your family history, because that comes into play with regard to lots of different scenarios, from your risk of cancer to even potentially something like the type of anesthesia that you should or should not be getting. And there are questions that can be very helpful to ask your doctor to serve as a guide in various scenarios. There is a downloadable set of questions that are not focused on menopause directly. I will look for the link for you to put in the chat that come from the book. But I always say that it's really important for you to ask questions so that you understand what you need to understand to do what you can to optimize your health and well-being, and to be adherent to the recommendations that are being made for you that you've decided are a good fit for you. I have always been on the soapbox as it relates to being an advocate for yourself and your loved ones, because no one is going to care as much about your health and well-being as you are, save a parent for a child. And I frequently say that I wish that everyone was as great at advocating as what you will often see with parents who have a child with cancer or a rare condition, where they may become even more expert at certain things than the people who are rendering care, how they overcome their fear, how they keep asking questions until they understand, and how they take hold of the situation. Next slide, please. And so, as much as possible, within the constraints we've already talked about, if you can partner with your doctor or other healthcare practitioner, and hopefully it'll be someone who sees you as a whole person, and as a person who may have a condition versus a condition who happens to be attached, that happens to be attached to a person. Next slide, please. So asking for a second opinion, which there are several different instances where it makes a lot of sense for that to be the case. People may feel queasy about that, feel like they are going to make the physician uncomfortable about that. But remember, once again, no one's going to care about your health and well-being more than you will. And in certain circumstances, it may be the difference between life and death, etc. So if you find yourself in a situation where you aren't getting better after a reasonable period of time, if you feel like what you are hearing is not really hanging together for you, or if it's a scenario where the treatment is going to be very involved, then confirmation of a diagnosis totally makes sense. And to get a second opinion is particularly the case in cancer, where it is not infrequent that a diagnosis may change, which then changes your treatment plan, or a the stage of a cancer may be different after multiple eyes have looked at the pathology slide. It is also helpful, for example, with cancer, to make sure that you are learning about what all of your options are. If you feel like you're confused and need more clarification that is not coming from the people who are providing the care at the moment, that would be a time to seek a second opinion. And then when you're going to get a second opinion, it's really important to have all of that information available so the person who is providing another opinion has as full a picture as possible to let you know what they think and what they would recommend. And you can see in a study by the Mayo Clinic, 20% of people got a different diagnosis, and call it 66% of people had a refined or redefined diagnosis. So not a minor percentage, and therefore should make you feel more comfortable in terms of getting one when you feel like you need it, or if any of the scenarios that we've just talked about come into play. Then, if we can move on to the next slide, seeing your dentist, and this is really looking at things from every angle. Your oral health, your gum health can have a big impact on your general health. So, for example, if you have periodontal disease, which generates a chronic inflammatory process, that increases your risk of heart disease. It can make diabetes management more difficult. For women who are pregnant, it increases the risk of premature delivery. And so going to the dentist is nobody's favorite thing to do, but it is definitely something to keep in mind and as part of your whole person view of the care that you need. During the course of menopause, some of the symptoms you may have are a dry mouth, a metallic taste. You may have something called burning tongue syndrome. More likely that you will have receding gums. And so tooth decay, tooth sensitivity. So doing what you can to maintain your oral health is key to what is going on in the here and now as it relates to some of your symptoms, but also in terms of your future health and well-being. As it relates to dental insurance and the particular situation you are in, you definitely want to do the math, because most dental plans have a annual cap on how much they will pay. And sometimes it is the case that it would be less expensive for you to pay out of pocket than to pay the monthly premiums, because they may be more than you are going to get back in coverage. So I always recommend that people do consider doing the math of it all for that and all your insurance coverage, but particularly for dental. So in terms of eye health, during the menopause journey, your eyes can be impacted, and the menopause journey can literally impact your entire body, just like other processes, for example, like COVID, like some autoimmune conditions. And so during the menopause journey, you may experience symptoms like dry eyes, light sensitivity, some blurred vision, more tearing, swollen eyelids. Um, your eyes, they say they are the windows to the soul, but they're also potentially the windows to chronic disease. So, glaucoma, which is an eye condition, is picked up through an eye exam, but there are changes that happen where your eye doctor may be able to pick up things like thyroid disease, diabetes, hypertension, heart disease, particularly if your visits to your primary care physician are few and far between. Now, you don't want for those things to be so far advanced that it's the eye doctor who's making the diagnosis. But by the same token, it's better to be picked up by somebody than nobody. And it's also the case that if you have those conditions, then it becomes important for you to be on top of your eye health, more so than you might have thought. Next slide, please. So know your benefits. It's something that I would say that probably 95% of people don't know. Completely understandable when people are signing up for insurance, unless they're in the thick of some type of health situation or crisis, or they know that they have surgery upcoming, or they know they're going to have a baby, just as some examples, then the amount of time that people may spend looking at options they may have as it relates to their health insurance can be very little. And the time that you definitely don't want to be finding out whether something is covered or not is in the middle of a health crisis and you're lying in a hospital bed. So really understanding copays, coinsurance, deductibles, and what they are, the impact of being in a plan that may have a provision for out of network, but what are the potential financial consequences? Prior authorization, I think that people are familiar with, have heard lots about in the news. What I would say is that the percentage of things for which prior authorization is applied is less than you might imagine based on what you may hear in the news or read somewhere. But by the same token, just because of the volume of what comes through, that still ends up being a lot. What I will also say is that people very much underutilize their appeal rights, which if something is denied, you should get a letter that tells you you have the right to appeal and the reason that you were denied. And if you don't appeal, you're never going to get a yes. If you do appeal, you at least have a chance, and a high percentage of the time, much higher than most people think, you will get approved on appeal, particularly in a scenario which is one of the most common reasons for a denial is when there has been insufficient information provided to actually approve what's being requested. In some cases, none of the medical information has been provided at all, or in some cases, it's been very, very scant. So when you appeal, that is when you make sure that the people who are supposed to be providing that information actually follow through and send it in. And it's not uncommon when that happens that criteria have been met and that you will be approved. In some instances, with some employers, you may have the opportunity to appeal through your employer after the appeals to your insurance company um, have made the rounds. In some instances, you may also be able to appeal through a process that may be stipulated in certain circumstances by your particular state. But I would recommend, and I know that it's really exhausting and time consuming, but I would recommend, if it's a high dollar amount, particularly, for you to put the time and energy and effort into that. Next slide. So in terms of coordinating your care, I would say that, this is one of those good news, bad news scenarios. So you do have the ability, even though it may not seem like that, to coordinate your care. So that is the positive. The negative is that you really do need to coordinate your care. Well, once again, no one is going to care as much as you do. And given the complexity, the change in the way that medicine is being practiced, all of the technology that is now involved, it's not at all uncommon that your care is not going to be coordinated unless you are doing a lot of the heavy lifting. And you want to make sure that you know who's involved in your care and who is the lead, particularly if you are in the hospital and there's a lot going on and they're pulling in a lot of different people for consultation and input. As we talked about, taking notes during your outpatient visits, but it's important for you to keep track of that information, which brings me to the scenario with portals, which I'll talk about on the next slide. So there's a lot more information that is available to patients through portals these days than there used to be. It's important for you to follow up. If you have had imaging done, if you have had labs done, to make sure that you are following up to get the results. Silence is not necessarily golden. And you don't want to be in a position where somewhere along the way, something was found, it wasn't flagged, because people are human. It's not going to be 100%. Something gets missed, and you are going to be the one who ends up paying the price. So it's incumbent that you not just assume that if you don't hear anything, everything's okay, or that something didn't happen along the way and something else doesn't need to be done. And then in terms of your medications, to make sure you're understanding what you're taking, why you're taking it, how you should be taking it. And this becomes particularly important if you've been in the hospital and your medications were changed while you were there, or medications were deleted from your regimen, or medications were added to your regimen, because it is not uncommon for it to be the case that you go home and you may have new medications for a condition that you've had. And what you don't want to do is to be taking the new medication plus the old medication and not recognizing that that's something that should not be done, and not asking questions about, okay, now I've got these two things for diabetes, or I've got these two things for hypertension, whatever the scenario is. what should I be doing in this situation? That is that transition time when people are discharged from the hospital can be a time when confusion happens and things fall through the cracks. And so definitely a time to take things seriously and be asking questions and getting clarification. Being in the hospital is exhausting. You're fatigued, you aren't getting good sleep. You aren't necessarily going to remember everything that has been told to you, particularly if you're on pain medications, as an example. So, like I said, the good news is that you can do your best to coordinate your care. The bad news is you really do need to coordinate your care and not make assumptions that someone else is going to be doing that. If you're lucky, that will happen, and it does happen, but uh, you want to make sure that you are at least in a position to be plan B and the insurance policy if the coordination is not happening. Next slide, please. Patient portals. Um, I myself am a person who has really bad technology karma. So patient portals and I don't get along very well. Um, Other issues as it relates to patient portals is different practices and facilities may have different systems. They don't talk to each other. And so that may mean you have to have an account and a password in several different portals and have to update that information or pull information from the portals, which is a lot of work. The other thing that you want to find out is, although a portal may exist, that doesn't necessarily mean it's being used. So you want to find out, are you in a practice where that really is used and that is as a mode of communication? Or is it a scenario where the portal exists, but the people in the practice don't really use it, and then it becomes an exercise in frustration for you because you're looking for something that's not going to be there? At its best, using it can save time. You can get reminders about upcoming appointments. You can pull information and results off, and you can communicate non-urgent messages. As it relates to test results, what I will say is to not be surprised if you get test results and you see them before your clinician has seen them, because they may get auto-loaded and you may get to them before your clinician has had the chance to review them. And so there are some people who will not look for results for that reason. They want to get the results from the clinician so that it is within context, because when you're looking at some results, some of it may be pretty incomprehensible. And the tendency for many people, quite understandably, is to leap to the worst possible conclusion, only to then find out that it did not mean what they thought and that they have now worried and freaked out when it wasn't necessary. However, remember what I had said previously, that if you have had test results, then you want to make sure, if you've had testing done, you want to make sure that you follow up on what the results are. As it relates to your emotional health, things have gotten better in terms of the stigma attached to people's challenges as relates to emotional and mental health. There is still stigma, but very, very much improved compared to years ago, and particularly after the entire globe went through the trauma of the pandemic. And I can't stress enough that your emotional health is just as important as your physical health. The two things are very much intertwined, and for you may want to bucket them separately, but your body is not going to go along with that. So really be willing to accept help And just remind yourself that if you were a diabetic, you would be seeking help. And if you're depressed, it's no different than if you had diabetes from the standpoint of seeking help and getting the best option that uh, is a fit for you. So, speaking to someone who's a professional, but also getting support from family or friends, or there are support groups that can make a big difference. Finding a way to cope with the stress that everybody has to varying degrees at different points in their lives. And there are lots of opportunities there for that. To think about therapies that you may never have explored in the past. For example, the impact of mindfulness or guided imagery on your health and well-being and your stress level. And then lots of people find through their own spiritual practices or faith-based support is effective for them. As it relates to the menopause journey, this is a time that the hormonal changes can lead to new onset depression and anxiety. You may never have had those before and then find yourself in that situation. If you've had them in the past, you may then have an episode triggered. If you are in the middle of an episode during this time, then you may have an exacerbation. It may become more difficult to manage your symptoms. If you are bipolar, studies have shown that you may experience an increase in the severity or frequency of your episodes. It's also important to always be asking, as it relates to your symptoms, could this potentially be related to the menopause journey? So, for example, if your depression is related to hormonal changes, being put on an antidepressant may not help you at all. You may need to be on an antidepressant, but it may be that you also need hormone therapy in combination. Getting back to what I had said early on in terms of your eating habits, it has been shown the role of your microbiome as it relates to lots of different symptoms. And there's definitely a connection between your gut and your brain that then has an impact on your emotional and mental health. Next slide, and I know that we're running out of time here. So bring up the topic of health disparities. You see the definition there. I bring that up because you can see lots of differences for lots of reasons in terms of the health that people experience. As it relates to the menopause journey, something that people may not infrequently experience is medical gaslighting, where they may be completely blown off, ignored, told that their symptoms are just related to stress, told that they are simply too young to be going through the menopause journey. Medical gaslighting seen more commonly in women, more commonly seen in older patients, people of color, people with a disability. And so this is where it's important to know what health disparities may exist and therefore act accordingly and become as educated as you can. So, for example, there are certain genetic changes that are more common in one group than another. It's important to know if that is the case for you because it has implications in terms of the conditions you may develop and the treatment that you need and the timing of that treatment. With regard to medication and depression, there's certain antidepressants that work better in women than they do in men, for example. So it would be very helpful to know that. Heart attack symptoms in women can be different than the crushing chest pain that people are so familiar with, although that is still the most common symptom in women. But there are lots of others that are not the typical, and therefore you want to know what those are. Next slide. So this is basically saying to get your affairs in order sooner rather than later. I'll definitely stress the importance of taking all of these actions. Long-term care insurance, people are living longer. I always say, if you can afford it, that is something you definitely want to explore, because living longer and with the ever increasing price of healthcare, it can make a big difference decades later. And the younger you are when you get it, and when you're less likely to have a multitude of chronic conditions, the less expensive it will be. I won't say more affordable, because a lot of it is just beyond reach for a lot of people, unfortunately. I'm going to stop now to see if there are any questions.
No questions came into the chat. However, I just wanted to point out, and I think on that last slide you kind of touched on a few things, but your slide about coordination of care, I think that that is just so important, and not just for yourself, but also for others, whether it be someone in the family, like your children, or maybe even parents. That keeping all those tips in mind are important for others as well, and making sure that for especially for parents, that you have the proper authorizations through the healthcare system to be able to coordinate that care. And there's so much involved in that people need to really dig into to make sure that they are not only navigating their own health care journey, but others as well.
Absolutely.
Yeah. And then also with your book, just wanting to make sure people know where they can get it if they want to dive in a little deeper into this topic.
So they can go to navigatingyourhealthcarejourney.com, and then
Okay.
they can get more information about the book, and they can also order the book from that site.
Awesome.
And they on that site, there's also the downloadable PDF that has questions to ask your doctor.
Oh, that'd be very helpful. Thank you. Okay, well, I'm just going to move on into the next few slides that I'd like to talk about, just related to our positive health effort. And, this is something new that started this month here of March with our Menopause Journey community. We have a new challenge out there that people can join. You can find some information out there, as you see on the screen here at the positivehealth.com 6-week challenge. So if you're not a member, send us an email at info@positivehealth.com. We'd be glad to get you started on that, or you can go directly to the challenge site. Also, we have a YouTube channel. If you want to view other webinars, feel free to go out there and check out the many experts that talk about various topics related to menopause. Maybe there's something else out there that can help you out, or maybe someone else that you know. And our next webinar will be coming up here in April, the end of April. And we'll be bringing back our expert herbal clinician. And she will be taking us deeper into, the practical applications of herbal support for the menopause transition. So please feel free to join us for that. You can register at positivehealth.com/webinars. And we also have a podcast series. Here at Positive Health, we leverage the power of webinars and podcasts to bring awareness to everyone in regards to the many things to consider as you're going through your menopause journey. And for this month, we had Lauren Dyke join us. She is founder and CEO of Harmony Inclusive Wellbeing, and she talked about how to manage some of the chronic stress that is in your body, and especially during this menopause time. So feel free to go out to our positivehealth.com/podcast site to listen to her episode, as well as many other episodes that have been recorded last year. And you can also catch these podcast episodes on your favorite channels, Amazon Music, Apple Podcasts, Spotify, and iHeartRadio. And if you're not a member of Positive Health, you can still join for free until June 15th and take advantage of this one-stop digital health experience supporting your body, your mind, your spirit during menopause journey. There's a lot of content out there, a lot of help that you can look at different tracks of information if you're just wanting to focus on one particular topic regarding your menopause journey. So come out and check it out. Join us, and we'd love to have you. Okay, I think that that's a wrap, Dr. Edwards. Do you have any last few things you want to say to the audience?
I guess the parting words would be you have more power than you realize, and use it.
Wonderful. Well, thank you very much for all this great information, and thank you for joining us on this webinar.